March is designated as Endometriosis Awareness Month, and there's an event to help people get a better understanding of the condition and how it impacts patients. Tam Carter is hosting the event along with First Coast News' Keitha Nelson. She's the team leader of fertility for colored girls in Jacksonville, and Dr. Lena Foad is a reproductive surgical specialist. Welcome to First Coast Living.
Thank you.
Very important topic. I mean, once you hear about it, you realize there is actually someone I know who is being impacted by this, but you might not have realized it until you've heard of it and understand exactly what it is. So first, Dr. Foad, what is endometriosis for those who don't know?
Yeah, so endometriosis, just like you said, we know a lot of people that are affected by it. It's actually pretty common. It's about 10% of females worldwide, so that's 1 in 10, so it's quite common. It's a disease where the tissue that's supposed to be inside the uterus is actually located outside of the uterus in the pelvis, and sometimes outside of the pelvis, actually thought of more so now as a systemic disease, not just confined to the pelvis of the female. So, and that ends up causing symptoms of pain, sometimes infertility. So that's what endometriosis is.
And you mentioned pain, but what are some other common symptoms that someone might experience?
Right, so besides from pelvic pain, sometimes it can be painful periods, pain with normal, bowel movements, infertility. Sometimes we also see cysts on the ovaries and scar tissue inside the pelvis.
And Tam, you were diagnosed with this. How did you learn about it, and what ultimately led to your diagnosis?
I first was diagnosed in 1999. I just went to the doctor one day. I was in my freshman, sophomore in college, and I was just tired of pain. I was having to call in from classes, couldn't go to work. First day or two of my cycle, I was in the bathroom. It was very debilitating. So I just went to my doctor and said, hey, I'm losing money from not going to work. I can't get to class. So what can we do about this? And so he immediately took action, and we did a laparoscopy to diagnose, and that's pretty much the only way to get the diagnosis is to go through it's a minor surgery, but it is a surgery. And I was diagnosed with stage 4 at that point.
Wow. Okay, and so that's obviously a treatment option. Are there other treatment options, doctor?
Yeah, absolutely. So just like Tam said, the diagnosis is really done by laparoscopy. That's our gold standard. It is, however, invasive to do laparoscopy, so sometimes we just have to presume the diagnosis. But like Tam, when it's stage 3 or 4, which we consider advanced endometriosis, typically we do diagnose that with laparoscopy done through small incisions. Recovery is usually quick. So it's usually treated surgically at that point at the time of laparoscopy while we're in there, or we could treat it medically. With several medications are out there. So there are options.
Wonderful. And let's talk about the event to raise more awareness that you've created this
yes,
event, right?
It is called Shed a Light on Endo. So I created, organized, and hosting, and with Keitha, I invited her to come aboard, and she was open arms. So it's about bringing awareness to not just Jacksonville, but all over. I have specialists from as far as India, a master surgeon that will be on the panelist discussion, along with local doctors as well as Dr. Samuel E. Brown from Brown Fertility. He will be on as an exhibitor talking about endometriosis, and acupuncturists, and now a lot of the naturopathic ways of dealing with it, just because that has been my journey as I've dealt with it for over 20 years, having 3 surgeries and just decided I didn't want a 4th. So there are other ways of treating it, and that's the kind of thing I wanted to bring out and to just make Jacksonville aware. Endometriosis is very debilitating, and it is Awareness Month is in March.
So how can people get involved then?
They can register through travelyourchoice247.com/event. You can go on there, register. It is a charge. It's a discount for students.
Okay, thank you so much for joining us today and bringing more awareness to it, and I'm glad you're doing okay.
Thank you.
Doing well,
Yes.
and you look great.
Thank you.
You both do.
Yeah.
And if you'd like to see this interview again, just head to our website at firstcoastliving.net.